Hello, everyone. My name is Benedicta Masanja. I am the Director of Programs at Tanzania Health Promotion Support. I am very passionate about people development and growth as a certified people coach. And today I'm very pleased to share with you my leadership project titled Resilience and Renewal through Mentorship, Empowering Staff During Organization Crisis. THPS lacks a structured mentorship program, and we understand staff need stronger support for leadership development, confidence building and career progression, and especially for women who face additional barriers in accessing mentorship and leadership pathways. Evidence tells us that. So having such opportunities available would make even women access them and develop to fulfill their potential. As the purpose of my project was to introduce this mentorship and later a coaching initiative or program within the organization so that people are empowered and full achieve their potential. In 2025, we face severe challenges, as with many entities within the global health space due to the budget cuts, project terminations that happened, and even termination of staff, laying off of staff because of these project terminations. And we also face similar challenges. And so having a mentorship initiative was timely to restore confidence and rebuild organizational resilience. I was very happy on the 2nd of December when my leadership project was launched. Our executive director at THPS, Dr. Redemptor Batia, officiated this launch. And we also had a guest speaker, Professor Fortunata Makene, the executive director of ESRF, giving us a key note address on mentorship and coaching, which was very important for us to get an understanding of the purpose and the value of mentoring and coaching, especially in times of change and uncertainty. So the early results I'm observing is that appetite and need for people to get enrolled in the program is very high, even for those who missed, the deadline, who didn't respond to the email that was sent out to all staff, are currently approaching me to ask that if they can participate. So 14 were the early responders. Out of them, 8 were women who preferred to be mentees, and they had their motivation as to why they wanted to be mentored. And a good mentor pool through 12 respondents, 9 of them men wanted to become mentors. So during this implementation, from the conceptualization to the implementation, I am embodying the 4 pillars of leadership journey. That is authentic leadership, inclusive leadership, strategic leadership, and impactful leadership. Authentic is that I'm leading with purpose. I am fueling my resilience. Inclusive leadership, I've really enriched my mindset, looking for allies, and men are also part and parcel of this project. All staff were invited across cadres and department and gender. So this is very inclusive, strategic in the sense that I'm inspiring action. I'm leading change. We never had a mentorship program within the organization. And so it is important because my vision is also to see it embedded within our structures for staff development. Impactful leadership, yes. I am developing others. I have mentees, I have mentors. So we are learning, we are growing, we are developing as individuals throughout this process. And this is quite impactful. I'm very, very happy about this. So as next steps, I am going on with implementation up to the next year, even beyond the lift-off when we finish the program at WomenLift Health. And I will evaluate outcomes for mentors and mentees, but also gather all these lessons to document on mentoring during uncertainties, but also refine future phases and disseminate my findings so that they are useful, they're impactful for our organization, but other organizations too can benefit. So I'm very, very excited about this. I look forward to see all these outcomes I'm seeking and see people develop and thrive even at times of change, at times of major changes. Thank you very much for your attention and listening. I welcome any comments or questions if they are available.